I think one of the things that Montanans really need to focus on is that this initiative was adopted in 2004. So from 2005 through 2008, a fairly lengthy period, we only had 1,000 Montanans who had been authorized by a physician to use marijuana for medicinal purposes. And the president in 2008 ran a campaign where he had indicated that if elected, he would retrench enforcement efforts at the federal level, which in fact, through the Attorney General, the administration did in 2009. The number of cardholders in Montana went from approximately 1,000 at the end of 2008 to now well over 14,000 in 2010. The only thing that's changed during that time, the law hasn't changed in Montana, the only thing that's changed is the reality and or perception about what the federal government would do to enforce the law. And one must ask, what changed in terms of medical conditions of Montanans in that amount of time? It just doesn't seem like that explains this massive explosion. And yet, the real challenge here is this is a substantial segment of the population. The rate has gone up dramatically in 2010 alone. And at this point, it's a little bit hard to forecast exactly how many cardholders there will be by the time the legislature convenes in 2011. And obviously, the addiction that is going to increase over this period of time is something that I think both drug treatment providers, law enforcement officials, public health officials, and an awful lot of citizens are really worried about, because at this point we're well on our way to having a larger percentage of our population authorized to use medical marijuana than other states who have adopted this legislation. And I think when you look at the trend line, it's real reason for concern.